one. So Caregiver Burnout 101, this may be a review for some of you. This may be brand new information for some of you, but either way, I'm glad you're here and we'll go ahead and get started. So the agenda today is we're going to define caregiver burnout. We're going to talk about how you are assessed or treated for caregiver burnout and some ways that we can prevent it. Then we're going to go over very briefly the difference between burnout and compassion fatigue. And then I'm going to give you some quick tips on how you can get help when you are struggling underneath burnout. So first and foremost, what is burnout? Let me move my thing here so I can see my notes. Hold on. There we go. Okay. So first of all, caregiver burnout is very, very common. They've done studies on this topic, and they find that more than 60% of caregivers will experience symptoms of burnout. Okay, so that's more than half of you. So if you are experiencing burnout or you suspect you're experiencing burnout, you're not alone, right? I think it's just par for the course, right? Especially if you have a loved one whose disease or illness is progressive, and the way it started is not the way that it's ending. And so the needs become more intense, right? And so you may have been good in the beginning, you can handle it, you can do what you got to do, and you're fine. But as the needs increase, your burnout potential increases as well, okay? It is a very challenging reality that many of you experience, especially if you're very compassionate. It's very easy to pour yourself out without filling yourself back up, right? It's just kind of part of that. But caregiver burnout can manifest as a deep sense of physical, emotional, and mental exhaustion. And it often arises from that immense dedication that you have to your loved one, right? Pouring into them, managing their health, managing their safety, right? So you might feel stressed, tired, withdrawn, anxious, or even depressed, right? A lot of the symptoms that we're going to go over that are indicative of caregiver burnout are very similar to depression. So just be mindful of that. But those feelings are very valid, right? You're not alone. Like I said, 60% or more caregivers experience burnout. So there's definitely no shame in feeling this way. It doesn't mean that you are an inadequate caregiver or you aren't tough enough to do the job. Okay. You're a human being. Okay. So think about burnout as a candle that's burned through its wick, right? It just doesn't have what it needs to continue to burn, right? And so that can definitely help it happen to us as well, right? We've just burned ourselves out, right? Burnout, right? That's exactly why it's called that way. Um, but it is important to remember that your health and your well-being, they matter just as much as the health and well-being of the person you're caring for. I know I've said it 100 times that caring for yourself is caring for your caregiver or for your loved one, right? You cannot do what you do without making sure you're okay, right? So letting yourself be aware of the signs is the first step in making sure that you can get yourself back on track, okay? So what are the symptoms of caregiver burnout? So like I said before, it's very similar to depression, very similar to stress. So these are some symptoms. Of course, this is not an exhaustive list, but these are very common symptoms. So emotional and physical exhaustion, right? Maybe you wake up tired, right? Even if you've had a full night's sleep, you wake up and you're tired, right? You're just exhausted physically and emotionally, right? And we're going to talk a little bit about compassion fatigue later, where you're just really tired of caring, right? Maybe you're withdrawing from friends or family or other loved ones in your space, right? You're having a hard time engaging with other people. Maybe you've lost interest in activities that you used to enjoy, right? Maybe you enjoyed working out, or you enjoyed art, or you enjoyed socializing, and now you just can't even be bothered to do any of those things. Maybe you feel a sense of hopelessness or helplessness. And I will make a note here. I used to be the suicide prevention educator for Huntsville City Schools. And in my training, they said that that feeling of hopelessness is the number one feeling that people who survive a suicide attempt describe feeling, right? So if you find yourself in a space where you are feeling hopeless, I would definitely encourage you to reach out to somebody and talk to them about that, okay? Changes in your appetite or weight. So this is not necessarily a bad thing if you're intentionally trying to adjust your weight or your eating patterns, we're looking for a change that's different from the norm that you're not doing on purpose, right? So if you are like me and you can't eat when you're stressed, right? That's a change in your appetite. You could lose weight because you just can't stomach anything. If you're like my husband and you stress eat, you can maybe be, eating to comfort yourself or to cope, right? And that can cause weight gain. So anything that's different from what's normal, and it lasts for 2 weeks or longer can be considered a sign, okay? Changes in your sleep patterns, right? So maybe you're somebody who doesn't need more than 6 hours of sleep and now you're sleeping 10 hours, right? Or maybe you need 10 hours of sleep and you're only sleeping 6, right? It's a change in what's normal for you. Maybe you're having difficulty concentrating, right? You got that brain fog happening, and that can happen for a lot of reasons, but stress is a huge reason why we feel that kind of foggy sense. We have a hard time concentrating. Getting sick more often, right? Stress can cause us to take a hit to our immune system, right? Make it to where our sniffles turn into something more frequently. And then, of course, irritability, frustration, or anger towards others. And that doesn't mean that being irritated or frustrated is or angry is a sign of burnout. But if you're finding that it's happening more frequently, more often than not, or maybe you're having big reactions to small things, that could be an indicator that you're burnt out, okay? Because you don't have that capacity, you don't have your reserves, right, to buffer that reaction, right? It's just all kind of coming out, okay? So, of course, if you feel overwhelmed and you need someone to talk to, or you're feeling like you might hurt yourself or somebody that you're caring for, there are resources available, and we'll go over some of those later. But of course, the easiest one to remember is 988. That is a call or a text to the National Suicide Helpline 24/7. And I always encourage everybody, if you feel like you need it, call, right? There's no shame in that. So of course, if your burnout causes resentment towards the person you're caring for, or you feel like you might be wanting to hurt that person, just reach out, call a friend, call a family member, call a healthcare provider. You can call me if I'm at work. Just um, don't ignore it, right? That's the main takeaway from this slide. Don't ignore it. All right, so what does it feel like? Okay, so of course, everyone is going to experience burnout differently, but it may cause anxiety or fear, right? So maybe you're thinking, if I do something wrong, it's going to hurt someone that you're taking care of. You have a lot of anxiety or fear about caring for your loved one. Anger and frustration, again, that's kind of par for the course with caregiving. But sometimes if the person you're taking care of doesn't want your help or doesn't accept your help or appreciate the care that you're providing, that can make it a lot more intense. Denial, maybe you're denying the severity of your loved one's condition or thinking it isn't that bad, right? You're having a hard time digesting your reality, okay? Guilt, that's a big one. We all experience that, whether we're burnt out or not, I think. But spending the time to take care of yourself isn't as important in your mind as it is for taking care of your loved one. And to be honest, sometimes it's not, right? Sometimes the needs of your loved one supersede yours, and you have to do what you have to do, and that's okay, right? But the goal is to come back and take that time for yourself without feeling guilty, right? You have to do those things. Even if it just benefits you and not somebody else. But in reality, it's going to benefit everybody when you take care of yourself. Negativity. So your caregiving journey started positively, right? Maybe I got this. This is good. But now it kind of feels like a dark cloud is following you around, right? Maybe your feelings towards your responsibility are passive, right? Maybe you're feeling apathetic. You don't have a desire to do your job well, right? So you can see that um, the quality of care is declining. That could be a sign of burnout. Maybe you're feeling secluded or alone, which again is not uncommon for caregivers, especially if your loved one has a difficult time leaving the home and getting out and about and doing things. Guess what? It's going to be harder for you to get out of the house too, right? But if you feel like you don't have support or that no one wants to help, or even asking for help could be a sign of weakness and you feel that way, that is normal, but that's going to lead you to burnout, right? Um, so reach out when you need help, when you notice things are getting a little bit more intense for you, okay? So what causes caregiver burnout? Well, um, it's just caring for someone without caring for yourself, really, right? Where you're just constantly giving, and you're not filling your own cup, you're not taking care of your own needs, you're going to crash and burn, right? And whether that's true, whether you're a caregiver or not, right? If you're overworking, if you're doing anything overly, or what's the word I'm looking for? If you're doing any task that prevents you from caring for yourself, you're going to run into burnout. Okay. Um, so several factors can contribute to that overwhelm or that sense of burnout. One is role confusion. So role confusion happens when you kind of are just thrown into caregiving, right? Sometimes people know it's coming and sometimes it just happens overnight, right? Maybe, if you're caring for someone who has like vascular dementia, or they've had a stroke, or they've had an accident or injury, or, something that wasn't expected, very sudden, you can kind of be thrown into this caregiving role without any preparation time, right? And so that can lead to role confusion. Also, it's not uncommon to struggle with separating those responsibilities from your identity as child, spouse, parent. So when multiple family members are involved in caregiving, that confusion can lead to heightened stress for everyone, right? So that role confusion where, you were wife and now you're wife and caretaker, or where you were child and now you're taking care of your adult, your parents. It can be hard to kind of separate that role between your caregiving role and your other identities in that relationship. Okay. So that can cause you to be very burnt out. Varied expectations. So many caregivers start with that hopeful belief that your efforts are going to improve the health and the happiness of the person that you're taking care of, as well as your own, right? However, the reality can be a little different than that, unfortunately. Caregiving can be incredibly rewarding, but also overwhelmingly challenging, right? We all know that. Um, so balancing these mixed feelings is something that many caregivers find difficult, right? Especially if you are taking care of someone who their diagnosis is just going to cause them to decline, and it has nothing to do with how well you're caring for somebody, right? So you could be doing all the right things and still see a decline, and that can be very, very overwhelming. That can be discouraging. And so those expectations can lead to burnout. Lack of control. So again, feeling frustrated or limited by lack of financial resources, support from others or in your community, resources, or even just the skill to manage your loved one's care. That can be really disheartening, right? Sometimes, you have to do um, like nurse type activities and you don't have a nursing degree, right? You don't know how to do these things. And so that can make you feel very out of control. Having too many responsibilities, right? And that can kind of blend in with that role confusion where all these roles that you played, you have to do those, and now you're doing caregiving, right? So that's a lot of responsibilities on one person. And you're constantly juggling all these different obligations at once. And so that can be, of course, a recipe for disaster and burnout. Um, and also, of course, sometimes family dynamics play a role in this, where maybe you have other people in your family who aren't stepping up, but they also have all the opinions. They expect you to handle everything on your own. That can be really, really difficult to process through. And then failure to recognize burnout, right? That can cause burnout because you don't know what's happening. And so you just keep on trucking, right? You keep on doing what you've been doing. And then guess what? You fizzle out, right? So that's obviously a good part about this presentation. I can tell you what the signs are so that you can hopefully recognize it when you get to that point. But just remember, it is okay to feel overwhelmed, right? It's a very overwhelming job, right? You are literally somebody else's lifeline in a lot of ways, right? And so that's a huge responsibility that's very overwhelming. But acknowledging that you feel that way, that's the first step towards finding support and towards finding balance, right? Taking care of yourself is just as important, if not more important, than your care for your loved one, right? So reach out to support if you need it, when you need it, because you're not alone in this journey. Okay, there's a lot of people experiencing what you're experiencing right now, and there's a lot of support available. So what is the long-term impact of caregiver burnout? Well, when you dedicate long periods of your life to caregiving, it is very easy, again, to feel overwhelmed and vulnerable to physical and mental health challenges, right? You might find yourself putting off routine checkups with your doctor, delaying necessary treatment maybe for chronic condition because of your caregiving duties. Like I can't go and get my knee replacement and be in the hospital for however long because there's no one to take care of dad, right? So you're delaying your own care because of those situations that you might be in. And again, unfortunately, that's not uncommon, right? But that could be a long-term impact of caregiver burnout. It's just that self-neglect, really, and that's what caregiver burnout is, right? It's the result of self-neglect. But again, it's important to recognize that if mental health symptoms like depression or anxiety are left unaddressed, both the quality of your life and that of your loved one are going to suffer, right? Your loved one is going to thrive when you take care of yourself, right? So it is very vital that you prioritize your own well-being. Um, so in extreme cases, stress and depression that come with caregiving burnout can be seriously threatening, right? Depression can very quickly and covertly slip into suicidal ideation, which is those thoughts of suicide, or morbid ideation of thoughts of, well, I could go to sleep and I'll wake up, right? That kind of thing. It can be kind of sneaky. It can kind of just happen overnight, or it might seem like it happens overnight, but it doesn't. But unaddressed, it can definitely go from bad to worse very, very quickly. So again, just being mindful of those symptoms and know when it's time to reach out for help. Assessment. So if you feel burned out, you might choose to go visit a healthcare provider or mental health professional or social worker to get assessed. Okay. And that's great. If you feel like you need to do it. Okay. But an assessment would probably just be they'd evaluate your mental health, your physical health, probably ask if there's any medications you're taking to see if that could be addressed in that way. But it is important to be honest with your provider, right? Be very open about what's happening. Don't underplay it or deny it because then they won't be able to give you what you need, okay? And it's very common, at least in my experience talking with caregivers, where you compare what you're going through with burnout to the diagnosis of your loved one, right? Well, it could be worse, right? Or they need this and I don't, so they're worse off than I am, so I can put myself off, and that works until it doesn't, right? So again, you matter too, not just your loved one. And if you care for your loved one and you have a hard time caring for yourself, just remember, caring for you is caring for them, if that makes it easier, okay? So how is burnout treated? Well, just like there's no one way to feel burned out, there's no one way to treat burnout, okay? You'll likely have to try more than one strategy until you feel well again. But here are some ways that you can get that started. So again, talk to your healthcare provider, right? The amount of stress and emotional weight that comes with being a caregiver can feel, again, overwhelming. And it helps to reach out to your doctor, your psychologist, social worker, or any mental health professional to discuss how you're feeling, right? And if you have a care team like friends, family, doctors that are helping you, just let them know that you need that support right now, okay? And it doesn't have to be forever, right? Just until you get back to where you need to be, right? Next, make time for self-care. I know we pound this into your heads over and over and over again because it is so, so, so important. And it is not selfish to take care of yourself while you're taking care of someone else. Okay. It is essential to do that, right? So don't skip your appointments. Don't, not go to the dentist. Don't, skip out on your mammograms. Don't skip out on your annual checkups, right? Make sure you're eating well, make sure you're getting enough sleep, okay? A lot of times when we hear the term self-care, we think of indulgences, but really it's just about making sure that your human body is running the way it's supposed to run, right? You're putting the right things in it, you're getting the right rest, you're preparing for harder days, you're allowing yourself to have softer days when they come up. So you can do all the indulgences. Of course, I'm not going to tell you not to do those things, but it doesn't have to be that fancy or that intense. It's really just about making sure that your health and your wellness are being checked on at least every once in a while, right? You can also try exercising to improve your mood. And that doesn't have to be, 3 hours at the gym every day. That can just be light stretching in the morning, right? Maybe some yoga at night, maybe a quick walk around the block, right? It doesn't have to be very rigorous, just has to be consistent. Next, ask for help, right? That's a big one. It isn't easy to ask for help, and I would argue it might be more difficult to accept it, especially if somebody is coming into your space to take over for you and, you know, just be honest, they're not going to do it the way you do it, right? They're not going to provide the same care or better care than what you do. But accept that help if you feel that person is at least adequate, competent enough to take over for a little while, and just be okay with them not doing it exactly the way you do. It's fine. Just accept the help when it's offered if you can. Um, and another side of that is not just saying yes when someone offers help, but also being able to say no when more responsibilities try to show up and put themselves on your plate, right? You can tell people no, and that's okay. No, I think, is one of the overlooked um, self-care options we have. We don't like to say no sometimes, but I promise you, once you start, it gets a lot easier. Um, Next, find local resources, right? Organizations like ours, Alabama Lifespan Respite, and the respite reimbursement program that we offer, these support groups that we offer, these trainings that we offer. There's a lot of support out there, and sometimes that's all you need, right? Sometimes you just need someone like me on Zoom every week saying, hey, you got this, it's okay. You know, I know it's hard, and just empathizing, and that could be good enough for you, right? But there are also places like senior centers or respite, respite nights that some churches will have. There's the area agencies on aging, which we'll talk about a little bit later, that can help maybe offset some costs for you or allow you to have some respite, right? So there's ways that you can get that break when you need it. So can caregiver burnout be prevented? I would like to say yes. Ideally, yes. But again, I think sometimes it just happens because that's just the job, right? Sometimes you cannot take care of yourself. And so you are going to be burned out. But I would say that the intensity, once you know the signs, the intensity of your burnout and the time it takes to turn yourself back around can be shortened. I don't know if caregiver burnout 100% can be prevented, but here's some ways that we can go about at least trying to soften the blow a little bit, right? So finding someone that you trust just to talk, right? Talk about your feelings, talk about your frustrations. So that could be a friend, a family member, a mental health professional, social worker, right? Support groups. Even just being in a space where you know you're not alone can go a long way in preventing burnout. Setting realistic goals. Again, this can kind of sneak up on you, especially when your caregiving intensity changes over time, right? Maybe you had a goal that you were never going to put mom in a home, right? You were never going to place dad anywhere in a facility. And so you're trying to stick to that as long as you can. But needs change, right? So you have to be realistic about your goals. You have to be realistic about your resources. You have to be realistic about your loved one's needs. And so that can go a long way in preventing burnout, okay? Let's see, learning more. So education, I think, is our greatest resource for all things, but especially when we're taking care of our loved one, right? It'll help you feel more comfortable providing that care when you know the illness better, when you understand it a little bit better, when you know what the timeline looks like for you, and you can set those realistic goals. Um, and just being realistic about the condition, especially if it's progressive, like Alzheimer's or Parkinson's, and just knowing that there might be a time where, you do require more help, right? Or that your loved one might need to be in a space where they have a staff taking care of them, right? You're trying to do what, as one person trying to do what an entire staff of medical professionals can do. And that right there can lead to burnout, right? So just being aware and being educated about the reality of the diagnosis can go a long way. And then, easier said than done, take care of yourself, right? While you're taking care of someone else, make sure that your needs are met first. We've all heard that story or those instructions about the airline where they say, if you got to put your mask on first before you help anybody else, it's the same thing, right? You cannot burn yourself to the ground and end up in hospital and then expect everything to be okay, right? So you have to take care of yourself, even if it's just for like an hour, 2 hours out of the week, something that's just for you. That's not a luxury. Again, this is absolutely necessary for you to have that time to yourself. Eat well. Although I know that again is easier said than done. Sometimes we don't have time between, doctor's appointments and laundry and medications and all the things that we're doing to actually sit down and have a good meal. Sometimes you're just grabbing, a handful of grapes out of the refrigerator on your way through or something. You're not even really sitting down to eat. You're just shoving food in your face. So it's very easy to forget to eat those 3 complete meals a day, but that's how we fuel our bodies, right? That's how we have the energy to do what we need to do. So you wouldn't put chocolate pudding in your gas tank and expect it to drive down the street, right? You have to give it the right kind of fuel. And so it's the same with us. We cannot run with an empty gas tank. And then finally, accepting your feelings, right? Especially, I encourage people to accept those feelings that maybe are quote unquote negative, right? A lot of times we push those feelings down because we feel ashamed that we're feeling apathetic or that we're feeling frustrated, or that we're feeling angry, right? Um, but all those things are normal, right? And bottling them up, shoving them down, ignoring them, that's not going to make them go away, right? It's just going to make them fester, make them worse, make them more intense. And that's going to lead to burnout, right? So being honest with the way you feel, accepting that as part of the journey, not guilting yourself or shaming yourself for feeling the way you feel, that can go a long way in preventing burnout, right? Remember, you're a human being and you're allowed to do human things, right? It's okay. So, briefly, what is the difference between burnout and compassion fatigue? I don't know if you guys have heard that term before, but compassion fatigue kind of comes from the healthcare world or the helping professions world, like nursing, therapists, EMTs, things like that. Um, so both caregiver burnout and compassion fatigue will impact you as a caregiver. So caregiver burnout is that feeling, again, of deep exhaustion and stress after taking care of another person. But compassion fatigue happens when you take on the emotional stress and the trauma of a person that's in their care. So even just, watching someone suffer, right? That can be very traumatic for us. Um, and so that can cause a lack of empathy, okay? Um, and that can be kind of jarring for those of us who are naturally more empathetic or very compassionate people to suddenly feel apathetic or feel like you don't care, like you don't have empathy for that person anymore. That can really have a negative impact on you, right? But really think of it this way. Think of your compassion as a muscle, okay? So if you're always flexing that muscle and you're not giving yourself any rest or recuperation time, that muscle's going to get fatigued. It's going to get worn out and it's not going to be able to do what it does anymore. It's the same with compassion, right? So if you're always flexing that compassion muscle, it's going to get tired. It's going to get fatigued. And so having those times where you can practice self-care, where you can take those breaks, where you can release and relax that compassion muscle, the chance of it getting fatigued becomes less and less and less, okay? And it's important to know compassion fatigue and burnout can happen at the same time. Okay. So you're physically exhausted, emotionally exhausted, mentally exhausted, right? It's just a very deep, deep, deep rooted exhaustion, and it covers the whole gambit of who we are as a human being. Okay. So this is not uncommon, unfortunately, but hopefully at the end of this, you'll see that it doesn't have to be an inevitability for you. Okay. You can take that time for yourself and not be facing the intensity of both caregiver burnout and compassion fatigue at the same time. So getting help. So if you experience severe stress and depression, seek medical attention. Okay. Just like if you were to break your arm, you go to the doctor, right? It's not any different. Depression and stress are treatable, and they do get worse when you have caregiver burnout. Okay. So reach out for help with some of these resources. So there's home health services, right? You guys probably know about these in the area. They are agencies that provide home health aides or nurses for short-term care if your loved one is ill. And some agencies will provide that respite care for you. Again, I'm going to mention the Area Agency on Aging. They will often contract with home health aides and be able to send people out to you. Our respite reimbursement program, it can help you offset the cost of either an agency or just a friend or family member coming in to help you. Or even sometimes there's like camps and things like that that your loved one can attend, or daycares. And so those respite costs can get kind of high. And so our program kind of helps to cover some of that for you. Adult daycare, I just mentioned it, but I'll mention it again. So these are programs that offer a place for adults over the age of 65 to socialize. A lot of times they'll have different activities they can engage in, and also receive medical or non-medical, depending on the facility services for your loved one. And this can be great for you, but it can also be great for your loved one that you're taking care of, right? Sometimes they get tired of seeing you all day too, right? Sometimes they need a break from your face. Not that it's not a lovely face, but change is always good for everybody, right? Change of pace, change of routine, change of environment can be really good. And then just being around your peers, right? Being around people who understand their stage of life, their chapter that they're walking through can be really, really helpful for them as well. So don't feel bad for utilizing those services. Nursing homes or assisted living facilities. So, of course, we're not saying indefinitely, but sometimes they will offer short-term respite stays just to give you a break, or if you have maybe a trip coming up, or maybe you just need some time off, you can use those services through those facilities. Private care aides. So those are professionals who specialize in assessing the needs and coordinating care services. Um, that's kind of similar to those home aides, home help aides. Caregiver support services, so support groups, programs like this, right, to help you recharge your batteries, meet other people who are coping with similar situations, finding more information about your health conditions, or even locate additional resources, right? Those are places that you can help build community, especially if you feel like you've lost community since you've become a caregiver, because, unless you're doing it, you don't really understand it. And so it can be really hard for people around you to um, follow along your journey with you because they just don't get it, right? So having those supports with people who do get it can be really, really helpful for combating or negating the effects of caregiver burnout. Area Agency on Aging, we have 13 of them in Alabama that serve all the counties across the state. So wherever you are, there is one that you have access to. And of course, they offer things like supports, caregiver support groups, respite care, things like that. Each one will offer something a little different. So I encourage you to contact your local one. National organizations. So you can look online for agencies that have like national chapters or local chapters, and they can assist people who have specific diagnoses. So like Parkinson's disease, I know here in Madison County, we have Parkinson's Dynamics, and that's a great support for people that are walking the same journey. You can go online to the Alzheimer's organizations, and they have a ton of information, resources, call lines, right? 24/7 hope lines that you can call. And so there's a lot of support out there. You just have to be willing to look for it. Okay. So that's all the info I have for you today. I will stop my share and the recording.